Guys, in this video we want to look at this condition Rhinitis Caseosa. Okay, so actually some people are saying nasal cholesteatoma, all this refers to same thing, and sometimes they are linking it with fungal sinusitis. Okay, anyways, remember it has something to do with the sinus also, the nose, the sinus, everything together. So rhine is what? Nose, itis is inflammation, caseosa some cheesy like material in the nose. So basically this is a type of chronic rhinitis. Okay, so here you can see Rhinitis Caseosa. It's a chronic condition, long duration. What is there? Itis means inflammation. Inflammation of what? Rhine. So the nose, inflammation of the nose, a chronic condition, Rhinitis Caseosa. This is actually seen mostly affecting male. Okay. So here what exactly happens? Look at this. It's an uncommon condition, not at all very common, and the literature is actually very less on this. It is unilateral, only one nose, okay, and it is mostly affecting males. Now let us say this left part is affected, unilateral, so, and it is affecting males. It's an uncommon condition. Nose is filled with offensive purulent discharge. It's an offensive, so it's smelly, purulent, pus discharge, and cheesy material. That is why the name Caseosa. Right, cheesy material. So these are the words you'll have to write. So here you can see an image, right, inside the nose. Some cheesy material, offensive, purulent discharge will be there from this guy's nose. Okay, discharge from this guy's nose will be purulent, offensive discharge. So let's put a purulent, offensive discharge, and that shouldn't look very yucky also. So let's just add a purulent, yucky discharge here from his nose. Oh, left side was affected, right? So let's put it on the left side. Purulent, offensive discharge and cheesy material. So we're using that color, cheesy color, right? Okay. So why does this happen? Let us look at this. This guy had chronic sinusitis. Okay. So from this chronic sinusitis, this disease is arising. So they are also saying it is possibly, they don't even know, the disease possibly arises from chronic sinusitis, and maybe they are linking the sinusitis with fungus because some literature says that, but here they are not seeing exactly what causing the sinusitis, but a chronic sinusitis with collection of inspissated cheesy material. What is this inspissated? It's nothing but thicken. So thickened cheesy material. Inspissated just sounds like a very fancy word. It's just thickened cheesy material. So from where is it coming? From the sinus, from chronic sinusitis. So this guys, these sinuses, let's say, were affected, right? So all these sinuses, they had some infections or whatever, inflammation, chronic sinusitis. Because of it, cheesy material is now getting accumulated in the nose, isn't it? So, thickened cheesy material. Okay. Sinus mucosa becomes granulomatous. The mucosa of the sinuses, isn't it? Sinus mucosa becomes granulomatous. Okay. So now how is the sinus affected? They are saying it's become granulomatous. The bony walls of the sinus may be destroyed. So you will have to differentiate all this from malignancy. So whether this person has cancer or just a Rhinitis Caseosa, you'll have to check. So basically what is happening to the sinus mucosa, it becomes granulated. So let's say the sinuses here, the mucosa, everything is granulated. The bony walls of the sinus may be destroyed. Are they using the word destroyed? The bony wall of the sinus may be destroyed. Yes. So here they are telling that you will find cheesy material in the nose, but actually what is affected is the sinus, and that is where everything came from also. The cheesy material, etc. arising. The disease probably arises from chronic sinusitis with collection of this cheesy material. Okay. So mucosa becomes granulomatous. Okay. So what are we looking at, people? Today, Rhinitis Caseosa. What is it? It is a type of chronic rhinitis. Okay. What and all we saw here? Something from the sinus it's arising, and in the nose you are finding what? Cheesy material. It is unilateral condition. Basically, what is affected is the sinus itself, the bony destruction of the sinus, the mucosa has granulomatous, and chronic sinusitis this guy has, right? Okay. This guy has discharge, don't forget, discharge, offensive purulent discharge and cheesy material. Nose is filled with cheesy material. Where is the cheesy material? In the nose. Okay. So let's move on to the treatment. Just look at this. If you find cheesy material in the nose, it can be that the sinus are affected. Very uncommon condition they are saying. Okay. Treatment for what? Rhinitis caseosa. Treatment. Caseosa. Okay. Treatment is removal of debris and granulation tissue. Free drainage of affected sinus. So the affected sinus, they should be allowed to drain. That's all. Prognosis is good. Nothing to worry. Patient will become fine. Prognosis is good. Okay. So let's take a recap. Rhinitis caseosa. Some people are saying it is nothing but also called as nasal cholesteatoma. So basically it's a type of chronic rhinitis, inflammation of the nose. Here what is happening is this person will have, males usually, unilateral condition. It's an uncommon condition. The nose will be filled with cheesy material and this guy will be having offensive purulent discharge. Pus kind of discharge from the nose. Offensive. So it kind of is foul, smelly maybe. And from where, when you check this, usually it could be because of chronic sinusitis. Okay. And the sinus mucosa may be granulomatous and the bony walls of the sinus may be destroyed. You may have to also rule out malignancy. This is how it is looking inside the nose. Treatment is just remove this debris, remove the granulation tissue, allow the sinus to drain, and prognosis is good. So that's all for now in rhinitis caseosa. Bye bye people.